Hello friends, I am Dr. Girish Bhalerao, Senior and Chief Consultant Orthopedic Surgeon here at Mumbai. Today we are going to talk about ankle problems. Ankle and foot is a very complex appendage which involves a lot of articulation and a lot of bones. So if you see, typically the ankle joint is formed between tibia and fibula, which are your leg bones, and the heel, which is the first bone taking into participation of your weight bearing. Between these two aspects, there is a bone in between which is called talus. Now talus is a very specialized bone of our body because it is the only bone which does not have any muscle attachment and it is completely covered by cartilage. Only 5% of it is covered by ligamental anchorage. So talus plays a very important role. In general, all across the body, most of our tissues have dual blood supply. However, there are certain areas where a unilateral blood supply supplies the entire aspect of that particular anatomy. Talus is one such bone. With this kind of configuration, the talus usually offers a lifelong articulation with its smooth movement. Being the first joint from the ground, it is usually pretty stable. However, there can be challenging issues where a patient can have certain kind of trauma which can have periarticular or intra-articular fractures, disturbing its anatomical profile. Sometimes the blood supply of this talus can be challenged and can cause osteonecrosis or arthritis. Whatever the situation may be, an ankle arthritis is a very severe problem which, though rare, once it happens, it has got very serious implications. It can affect your daily living, you cannot step on your leg, you cannot walk through. To offer solution to this, usually unlike other joints, ankle replacement is still a developing stage. Ankle replacement programs have very challenging configuration because the implant specificity may not be customized to that particular patient's makeup, and hence ankle fusions are still a thing in vogue. What does ankle fusion mean? Ankle fusion surgery is also called arthrodesis surgery. In this, either through intramedullary ways or extramedullary ways and cortical fixations, the articular surfaces of the joints are fused to offer no movement such that it is fixed in a functionally optimized way so that it will offer movement in the one joint below and one joint above, so that your range of motion is still intact. With certain limitations and physiotherapy programs, you can go back to your routine activities. There are various types of fusion programs which are accepted in ankle. It can be a hindfoot fusion using a TTC nail, or it can be a midfoot fusion or a midfoot forefoot fusion. So ankle problems can have various implications, and a customized approach to this problem does make a difference in patients. If you have any foot and ankle issues, it can be your sports medicine, it can be your ligamental instability, it can be chronic pain which is not getting settled, please do connect with us to offer you an optimized, customized solution so that we get your foot and ankle back to your game. Thank you.